Welcome back to an introduction to breast cancer. I'm Dr. Anise Chagpar. In our supplementary lecture, we talked about diet and exercise and weight management in the whole management of breast cancer, how this can really improve overall mortality. In some studies, it improves breast cancer-specific mortality. And I told you that we would get some interviews to give us a little bit more in-depth information. So it's my pleasure to introduce you to two of our eminent researchers in this area here at Yale, Dr. Tara Sanft, who's a medical oncologist and also our director of survivorship, and Dr. Melinda Irwin, who has done so many really great studies looking at diet and exercise and weight management in the whole area of breast cancer. So thank you so much for joining me.
Thanks for having us.
Thank you.
So maybe, Tara, we can start with you and talk a little bit about how that trifecta, diet, exercise, and maintaining an ideal body weight really helps in terms of breast cancer prevention, breast cancer recurrence, breast cancer survival. What are the data, and is it really one piece of the triad more than the others, or is it a bit of all of them?
Well, I really think that this field has evolved over the past decade or 2 decades or so. We know that obesity in and of itself is a risk for developing breast cancer. And so the idea of maintaining a healthy weight prior to diagnosis is important. It's not just important for breast cancer, of course. Obesity is linked with diabetes and heart disease, and #1 killer in the United States currently. So that whole issue has been a hotter topic in the past few decades, as we've seen other studies that show that exercise and diet may improve outcomes. So as we've gone forward from the time of diagnosis, looking through treatment and beyond, we notice that even if you are inactive or overweight or not eating a healthy diet at the time of diagnosis, that is possibly a good thing to change those things, and that might have a favorable outcome in terms of breast cancer. So we see through the data that women who exercise after breast cancer have a lower risk of recurrence. And we see some signal that possibly weight loss after diagnosis may also improve outcomes. There's a large study right now called the Be Well study that's aimed at looking specifically if weight loss improves disease-free survival or recurrence.
So really important stuff. But Melinda, you know, one of the things that we talked about in lecture was that so many people, when they go through breast cancer treatment, gain weight. So what do? You've gained weight. You know that that is possibly going to adversely affect outcomes. You've done some studies that have really looked at trying to get people to lose weight. Talk about that. How do you do that exactly?
Yeah, so Tara is absolutely correct. You know, a lot of the research used to be on preventing cancer and the benefit of these behaviors for multiple outcomes, and now the research is really looking at among those diagnosed with breast cancer. But even more importantly, what we are focusing on is during treatment. So a lot of the research was after completing treatment, and that's when the women have already maybe gained their weight or had adverse changes in their diet and exercise. So what can we, the oncologists, the hospital, the scientists, all of those working with the patient do to help her lower her risk of gaining weight during treatment, increase her ability to complete all her treatment regimens. So what is it that we can do during treatment and make sure that these programs are something that is available to them in their community, at their hospital, not something that they have to do above and beyond their treatment, but it's a part of their treatment care. And so the message preventing weight gain is really important. So from the second that they're diagnosed and they're seeing the surgeon and then maybe the oncologist, also at that time meeting with the dietitian, meeting with the physical therapist, and thinking about a treatment plan related to their lifestyle behaviors.
And so what are the practical tips, Tara, that you give women who are diagnosed with breast cancer who, let's say, are feeling some guilt because they are overweight? They know that that increased their risk of developing breast cancer, but now they really have made a commitment that they want to lose weight, but they're facing, a chemotherapy regimen or endocrine therapy that we know is going to help them to gain weight. What are the practical tips that you give them to help them to prevent weight gain?
Yeah, so we usually start where the patient's at. So I think that has to be, as practitioners, we really have to get into that mindset that it's not one size fits all. And you can't just tell everyone, only eat fruits and vegetables and exercise 150 minutes a week and then expect that to happen. It really has to be a partnership between the physician or the healthcare provider and the patient. So where are you at? The time of diagnosis is one of those teachable moments, right? Where most people are willing to do something, or they want to take on a major life overhaul. So how do you get from, let's say, 0 to 10? Well, it has to be baby steps. And so it's really meeting the patient where they are and then small incremental changes. And so we're actually studying this at the time of diagnosis to see, number one, how do we get patients to be where they want, meet their goals during treatment, which has historically not been part of a healthy diet time in their life. Usually it is afterwards, but that time is too late. So it's really working one-on-one and trying to meet basic goals first and then building from there.
One of the things, Melinda, around the time of diagnosis when you're going through treatment, there's a lot of stress involved. And we know that there is kind of an interaction between stress and hormones and inflammation and diet. And that can kind of be just a terrible cauldron for people to deal with. Talk more about the scientific interrelation between all of those factors. Because it seems to me that just the stress of the diagnosis alone can sometimes prompt people, if you're anything like me, to go for the donuts instead of the carrots.
Very much so. So the mechanisms that mediate the relationship between obesity or poor diet or inactivity and cancer outcomes are inflammation is one of them. So we measure that in the blood via a marker called C-reactive protein. So in our studies, we can measure what your CRP, your C-reactive protein level, is at baseline, and then we have our intervention, and we can measure that again at the end. We also can measure stress levels, cortisol measured in your saliva, and look at changes in your cortisol or your stress level. But it is true, at diagnosis, there's so many different things going on. So the study that Tara was discussing that we're doing that's during treatment, we have 16 sessions that can be done in person or over the telephone with our dietitian, Maura Harrigan and Courtney McGowan. And these 16 sessions are built it's a nice structure, but they are personalized. So even though we try to have a one-size-fits-all, everyone comes to their diagnosis in their first year and years after with a different challenges and whatnot. But we try to increase their knowledge as to the benefits of these behavior changes and the skills to eat healthy. So for example, when you're feeling stressed and you might want to turn to that snack food or that cookie or that treat, what are your triggers? How do you know to sort of know that that's coming on and therefore plan appropriately? With exercise, don't go anywhere without a good pair of walking shoes. Really map out and plan out your day so that you might have pockets of time where you could go for a walk or something. So the counseling sessions we have set up are really geared to help people prevent the poor eating and the inactivity to come in, and how we can work with them.
Yeah, right. And so it's wonderful that at the time of diagnosis, you have kind of this plan in place. People can work with their oncologist, with the hospital, to try and make these baby step changes. When we think about obesity being a risk factor for developing breast cancer, a lot of people may be wondering, when is that? Is that childhood obesity? Is that obesity during your middle age? Is it right at the time of diagnosis? What if you couldn't prevent how large you were when you were born?
That's right. And, I think Melinda has the career of looking at all of this, so you please chime in. But, we're not entirely sure when the risk switches. And in fact, there's some suggestion that perhaps at some point in your earlier years, obesity for some reason might be a little protective. And I don't think we understand all of those mechanisms. Again, back to sort of what I was saying before, though, chronic inflammation, chronic stress, and overeating, inactivity, not a healthy diet, those things are bad for lots of reasons.
Right.
And it's not just breast cancer, and it's certainly not just your mental health. It's all your whole body's health.
Right.
And so why I love this kind of work is that there's very little downside to trying to help people do better. Now, we're not saying everybody needs to run marathons or fit into skinny jeans. That's not it. It's how do you make choices for yourself so that you feel really good about where you are and you're meeting the goals you want to achieve.
So I think to that point, a message we like to tell our your patients or our study participants is it's never too late to walk a little bit more, to eat a little healthier. And I will still align that. Maura Harrigan often says tomorrow is always a new day to eat smarter and move more. So, we all have bad days, but you're going to go to bed, you wake up the next day and you can start, fresh. But I think there are different times in our life when there may be more critical windows or time periods that it could affect disease outcomes. But from the research that we have reviewed, it's never too late to start a healthy habit. There's always some benefit. I mean, there's a lot of research done in older individuals in their 70s, 80s, and 90s showing a benefit. Whether if it's not on disease, recurrence, or mortality, it might be on quality of life or a side effect related to treatment.
And my last question to you, Tara, is this. That's such a good point. That it's never too late. In the olden days, however, after people had gone through a surgery for cancer and they went through chemotherapy, people may have thought, you need to rest, don't lift too much. It seems to me that advice is now changing. What advice do you give patients in terms of getting out and being active? Are there restrictions, or can they get back to doing everything they normally do and perhaps adding more if they weren't as active as they should be?
Yeah, so this is a great point. So historically, after surgery, we would say, whatever you do, don't lift anything because you might get swelling in your arm. Or if you're on chemo and you don't feel like doing anything, just eat ice cream. Just make sure you're taking in enough of everything.
Yeah,
eat
enough
whatever
calories.
You want. It's okay. If you don't feel like doing anything, don't do anything. I think it came from a good place. I think it was compassion-based. But what we've found is that people do better when they're actually really engaged with how they're moving and how they're eating. And so I just start there with my patients and just try to, number one, we've debunked the fact that lifting things makes the swelling worse. We've actually shown it's safe. And it's safe to exercise during treatment and after treatment. It's safe and it's feasible. Women want to do it. So it's really on the providers to start messaging it a little bit better. And I think we start by saying, listen, we know that we've shown that this helps with fatigue, it helps with sleep, it helps with mood. So why not do it just for those reasons? We think it might actually also help with disease outcomes. That's what we're really trying hard to prove. We want to save lives too. But in the meantime, eat smarter, move more. That's probably doing yourself a favor. And it puts the patient as part of the partner in the treatment plan.
Yeah.
The first part of advice made them very passive. This actually gives them something to focus on and do.
And one of the recommendations in our study, the LEAN study, Lifestyle, Exercise, and Nutrition study that's done during treatment is, as as providers, that after a person is diagnosed, family and friends with all very good intentions come and they bring a casserole dish or cookies or who knows what. And now we recommend that someone give of their time by going on a walk, a 30-minute walk with their friend who's had this diagnosis and undergoing treatment. So thinking, and the patient can tell their family and friends when they ask, what can I do to help? They can say, well, come to my house and go for a walk with me. So trying to switch the conversation that way as well.
Yeah. Well, it's such a great and healthy message. Thank you both so much for being with me.
Oh, thanks for having us.
Thank
this
you.
was fun.
Until next time, I'm Dr. Anise Chagpar.